Hello, everyone. Welcome to our monthly webinar for Mexico Bariatric Center. I am waiting for everybody to join. So give us a couple minutes and we will get started. Yes, I am just waiting for everyone to join. So just give us a couple of minutes. Let's go over this. So if you guys have submitted a health questionnaire, which you can find on mexicobariatriccenter.com/health-questionnaire/. And you are in our system, you don't need to submit another HQ. So if you have not filled out an HQ, go ahead and do so. And when you do, please select Dr. Alejandro Gutierrez, which is going to be the surgeon who is presenting the webinar today. And will you be entered to a raffle? You watch the webinar to the end of our presentation, and you'll be entered for a $2,000 off of surgery. We would have a raffle at the end of our presentation. Okay, so it looks like we still have people joining, so I'm just gonna give a few more moments. We also, so if you have filled out a health questionnaire with another surgeon, that's okay. We can switch you to Dr. Gutierrez and enter you in the raffle, so you don't have to submit another HQ. As long as you have an HQ on our system, you're fine. But remember, the surgery is going to be with Dr. Gutierrez for the raffle, to be eligible for the raffle for today. Whichever doctor presents the webinar, that's the one we're doing the raffle for. So, so we will let the winner at the end to talk. If there's any specific issue that you want to bring up, you can put it on Q&A, and if you need to be talking to us, we can let you talk. But other than that, you'll be entering your questions in the Q&A tab on your screen. So I see a lot of people already putting questions on. Okay, so looks like we're getting enough people and it's evening out. So again, if you have filled out a health questionnaire off of MexicoBariatric Center.com/health-questionnaire/, you're good to enter the raffle. You don't need to enter another HQ into our system. But make sure you watch the webinar to the end, and we will enter you in the raffle and do the raffle at the end. Okay, so I want to welcome everyone. It's my pleasure to be spending about 1.5 hours of your time and going over what we have to offer at Mexico Bariatric Center and what the surgery has to offer for you. We still have the obesity is a pandemic in worldwide, and when we were hit by COVID-19, it actually made us be aware of our health more and our lifestyle and being healthy and staying in shape. As I mentioned, this is our January of 2023 webinar that we do monthly. My name is Ron Ellie. I'm the CEO and founder of Mexico Bariatric Center, MBC, and we have pleasure to have Dr. Alejandro Gutierrez to join us. He is still in surgery. He will be finishing soon, and he will join us so we can continue our webinar. Again, if you have filled out a HQ, you don't have to do it again. Just make sure you stay with us to the end of the webinar presentation. If you have questions, please enter it in the Q&A tab, and we try to answer all questions at the end as much as we can. The link for payment can be found on MexicoBariatricCenter.com/make-a-payment, and our bariatric vitamins is emergebariatrics.com. The subject of our presentation is obesity pandemic. So we're going to talk about what is obesity, what are the risks of being overweight, And then we're going to offer you the options for weight loss surgery and talk about MBC and what is it that we do, what is it that we offer. And Dr. Gutierrez is going to take over at that point and talk about different options. And at the end, we're going to open up to Q&A. That's when we're going to answer your questions. And then we do the raffle at the end. By definition, we have a formula that you enter your height and weight, and you get a number which we call body mass index. Body mass index, or BMI, is pretty much puts you in a spectrum from normal, overweight, obese, and morbidly obese. And that determines whether you are in the overweight or obese zone. Like I mentioned, obesity is a chronic disease. It's growing in worldwide. US probably has the top 10 has the most overweight and obese population. And then percentage-wise, we're about number 12. Basically, the problem with obesity is less physical activity, the high calorie, fast food, sugary food, and of course, genetics, how we're built. These are all contributing to the pandemic, obesity pandemic. I see that Dr. Gutierrez is trying to join. So basically, of course, our stress level is high. We do stress eating. We don't get enough sleep. In states like California, we used to just drive from our garage to our work and back and forth. We don't have public transportation to really walk, at least walk to the train, walk back. So there's none of that. Of course, the weight gaining drugs are also contributing to this problem. So on my, I hope everybody sees my screen or what I'm shared. So on my right side, you see that the fat tissues or fat cells, adipose tissues, are changed. The structure is changed from a lean person on the bottom to an obese person on the top. So when we gain weight, what happens is the number of fat cells increases. The structure also changes, which is causing less sensitivity to insulin, less sensitivity to leptin, not responding to therapies and vaccination. So that's what happens when we gain weight. Like I mentioned, in US, 40% of adults are overweight. So this is impacting 40% of the population. It comes with major health issues. And this is an animation that I'm going to play to show what happens when we gain weight.
Consider this. Our diaphragm is one of the major muscles that helps with breathing. Breathe in and the diaphragm contracts and the lungs expand to take in oxygen. But if you're obese, fat in the abdomen can push on the diaphragm, limiting how much air you take in.
So this basic animation shows the fat in the abdomen, what is causing for you to not to be able to breathe as much. Of course, heart disease, the stroke, lung disease, diabetes type 2, impaired immune system, chronic inflammation, blood clots. And when COVID hit us, basically the coronavirus attaches itself to the fat cells, and the more fat cells you have, there is more breeding ground for coronavirus to attach itself and make you more sick. And that's why 113% of people who are obese or overweight are more likely to end up in the hospital with COVID, 74% more likely to end up in the ICU, and 48% more likely to die because of COVID. And COVID hasn't gone away. So we still, regardless of all the other underlying medical conditions like heart disease, diabetes type 2, and then COVID just added up to the problem with being overweight. So lifestyle changes, exercise, diet, medications for losing weight is not a proven long-term solution for obesity. It only works for less than 10% of the population to lose weight with these diet, exercise, and medication, and keep it off long-term. Bariatrics, weight loss surgery procedures are proven, quick, safe, and long-term solution. Basically, once you get a bariatric surgery like gastric sleeve or bypass, what happens is the surgery causes your metabolic system to reset, which we call metabolic system calibration or reset. So your brain is interacting with your gut hormones. And when you change the hormones by the surgery, the interaction changes and it resets your metabolic thermostat. So if you look at a person who is like 250 pounds and they are overweight, their body, their brain and hormones and their gut hormones are used to interact around that weight. If you do extensive exercise and diet, what happens if you lose, let's say, 75 pounds, which is a miracle? You lose 75 pounds, and what happens is your metabolic system is still interacting around 250. Your brain and your hormones are used to that weight. So what it's going to do is going to make you more hungry and your metabolism goes down because it's trying to conserve energy. With the bariatric surgery, however, because the surgery changes your hormones, your hormone interaction with your brain changes. The minute you wake up from your surgery, your brain sees you at the lower weight. So what's going to happen is you're not going to be as hungry and your metabolism goes up. So that's the difference between a bariatric surgery and diet and exercise. That's why it's quick. That's why it's permanent. So talking about bariatric surgery being so effective, unfortunately, not all insurance companies cover, or if they cover, they have so many rules and regulations and out-of-pocket expenses. Even your portion of paying for surgery is more than what you would pay to use medical tourism and go over border to get the surgery done in Mexico. So medical tourism is offering people who have no insurance or they're underinsured to get this life-changing procedure. Mexico Bariatric Center comes in the forefront of medical tourism in Mexico. We're one of the top providers of bariatric surgery in Tijuana and Guadalajara. We are a US-based company. Our main office is in Sacramento, California. And we've been, from the inception, our commitment has been to the patients, to their well-being, and providing high-quality procedures in Mexico at affordable prices without compromising quality. We've been in business more than 10 years. We have performed more than 20,000 successful surgeries, and we work at this time with 7 top surgeons in Mexico. Our process is very streamlined. You basically fill out the health questionnaire, like I mentioned. Our surgeons review it, and you, once you approve, you pay the deposit, and you get on the calendar. And at the end, you just book your flight or arrange for your transportation to San Diego, and you submit your paperwork, and you are on your way to get this life-changing procedure. Our packages, what we call, are all-inclusive, so you don't have to worry about transportation. You don't have to worry about being in a hotel or being in a hospital. We took the stress out of your travel, your movement down there, so you can be focusing on your procedure. And that's what we do. So we keep you the first night in the hotel, and you be in the hospital based on your procedures, whether it's sleeve, bypass, or gastric balloon, 1, 2, or 3 nights, all the pre-op, post-op tests, all the medications you need, hospital fees. We have nutritional support before and after, private transportation, and we have aftercare. And we started offering discounted medical tourism insurance, which is of course optional, but I would definitely recommend you take advantage of that. So that covers your travel and covers if any complication happens from your surgery when you get back. So you would say, when is a good time? Today. Today is a good time to make a decision and get this life-changing procedure. If anything, coronavirus made our organization more strong because we had to overcome the challenge that COVID-19 created for us. So we came up with better protocols, more, more processes down there to make sure that you guys are safe. Support is a huge part of the before and after, more after, of course, of this procedure. Of course, we have 2 groups. One we call Inside Facebook. If you're on the fence, you want to see what it's like to go through this procedure, we recommend you join our Inside Facebook group. And if you are registered as a patient, now you're eligible to join our bigger group, which is our main Facebook group, which has over 10,000 past patients. And that is a huge support system for you, because support system is, of course, if you have relative friends that go through the procedure with you, that is a plus, but you also can take advantage of what we offer as a support for you. Of course, we have several of our past patients that we are working around the clock to make sure our patients getting more support even. Sarita, for example, she's on the Facebook group all the time. Rena, these are all past patients. Kelly, Judy, Dawn, these are all past patients that are out there to help you going through the procedure. We do have, actually, they have a podcast that they've been doing. It's very helpful to get on. We do have, for our nutrition, we do have a pre-op and post-op webinars every month. So you can actually jump on those. We do have our coordination webinars that our coordinators, again, you can join those webinars to get more information, detailed information. So there's a lot of different ways that we offer support for you. The process is very simple. Once you are on the calendar, you arrange for your travel to San Diego. Our driver is going to contact you the day before your departure, and they're going to arrange your pickup from the San Diego International Airport. By the way, we have two terminals at the airport in San Diego. One is pretty much southwest, and we call Terminal 1. That is going through renovation. So it's a little mess, but it's nothing to be worried about. And the rest of the flights like United and all those airlines come to the other terminal. We are offering the best team of surgeons anywhere you can find. Of course, you know, all of our patients know that, and they know how wonderful our team is. No matter which surgeon you choose, you are not going to regret it. Dr. Miguel Montalvo, he's awesome scholar. He's an awesome surgeon. Dr. Louisiana Valenzuela, she's our chief surgeon. Again, another huge factor to our success since the inception. We've been working with her 10 years ago. Dr. Alejandro Gutierrez, that is here with me today. We have a pleasure to have him with us. And Dr. Rodriguez Lopez, another super surgeon. We have Dr. Jacqueline Osuna. She is from Guadalajara that travels to Tijuana. She does surgery both places. Another very experienced, trusted name in bariatrics. And Dr. Jesus Ceja, another well-respected surgeon we have. So these are the best that are out there and we offering. Our system is pretty much established around patient care. If you see the patient submitted the HQ, goes through our surgeon liaison. Surgeon liaison is a bilingual physician that is sitting between all these surgeons and the patient. Of course, you always have the nutritionist, the dietitian support, and your case manager, which we call patient coordinator. Our pre-op diet is pretty straightforward based on your BMI. You start from 2-day clear liquid all the way to 8 weeks of pre-op. Of course, you know, the pre-op is not very difficult. If you stick with it, the better job you do in your pre-op, the better is your surgery success. We use Me Doctor Hospital at this point. This is one of the most experienced surgery centers for bariatrics in Tijuana. And we are fortunate to work with them. We use Hyatt Place Tijuana as our main hub for our patients to stay. From time to time, we may use other hotels like Fairfield, but mainly that's where our patients go. The first day that you arrive, basically we try to do all the pre-op tests. And that's why we ask you to arrive before noon. That gives our staff down there plenty of time to get all your tests done. So one thing about MBC is that, you know, there are so many pluses to go with our company. One being that we do everything in the one place. We don't transfer you for blood test. We don't take you for after surgery. We don't take you out to another center for getting your fluoroscopy. So it's all done in one place. It's all designed around convenience for you guys. So again, the hotel is a great place to hang out. Your companion stays with you the first night, stays at the hotel, and can take shower, be relaxed while you're in the hospital. We do have visiting times for our companions to see their loved ones, and the breakfast is free for them. There is plenty of places around the hotel they can hang out and enjoy their time, and at the same time be around you. On the day of the surgery, we basically pick you up on the time that our staff are giving you down there, and we take you to the hospital. Once you do the surgery, you be there for 1, 2, 3 nights, depends on your procedure. We do all the tests, multiple leak tests. Of course, our staff going to be around you, as well as surgical team, as well as the hospital staff. You fly home on the day of your release from the hospital, and you be back in the San Diego International Airport. If you fly in, you catch your flight, and if you drove, which some patients do, they go and pick up their car and they're back home. Again, so many pluses to go with our company. We don't like to compare ourselves a lot to different centers, but we know, like, some of the surgeons do so many surgeries a day. They don't have load management. They work 7 days a week. We don't have our surgeons work like that. We give them time off. They are only doing so many surgeries a day, so their load is managed every day. It's not like we give them 8, 10, 12 surgeries a day, and then the next day they have one. So we try to spread it across the days, the week, and month. So they're capped at certain numbers, and that plus using the best surgery center as far as their knowledge for bariatric patients. That's why our complication rates is less than 1%. That is huge. If you look at the published data in US, anywhere around the world, you see that our complication rates is about 1/5 or less than what the complication rate is in US. Basically, these are the options that we offer. I would say we're one of the most complete. We offer one of the most complete array of procedures, whether it's laparoscopic or endoscopic in the world. We do have scholars from other countries coming actually and watching our surgeons and getting training of how to do these procedures, from gastric sleeve, single incision, bypass, mini bypass, duodenal switch, SADI, all the revision surgeries, from the old procedures to the newer ones, band to sleeve, sleeve to bypass. We even do reversal surgeries. Of course, the endoscopic procedures like gastric balloon and endoscopic sleeve gastrectomy, ESG. These are the procedures that we offer. Of course, the endoscopic procedures are more for lower BMI patients, are not as effective as laparoscopic. So basically, this shows the spectrum of our procedures from endoscopic to laparoscopic. So it's time to say hello to Dr. Alejandro Gutierrez. Hi, how are you?
Hello, hi Ron. How are you? Thank you all.
Thank you for joining us. He is a double board certified surgeon in Mexico, which you hardly find any like that. He is a FACS member. His education, his training, his skills are just one of the top surgeons that we have, or anybody you can find in Mexico or anywhere else in the world. He's a very highly respected surgeon. I can't say enough about him, but I will let him talk about himself if he, why he chose to be a bariatric surgeon, and also start talking about our procedures.
Well, thank you very much, Ron. Thank you all for being here, taking your time with us. Apologize, I got a little bit late, but I'm glad seeing that it's a lot of us here connected. So we're gonna talk a little bit about the kind of the type of procedures that we do. So these are the most realized procedures in the whole world. IFSO and ASMBS were guided by their guidelines all the times. Actually, in last year, 2022, there was some review and new guidelines. So we're actualized and we're guided by the newer guidelines as well. So getting a little bit into the procedures that we do, we have the gastric sleeve surgery, which is the most common bariatric procedure done in the whole world. It started doing it laparoscopic. It was a part of a two-step procedure. So they did one procedure and patients returned a couple of months later. But patients, they realized that they were losing a lot of weight. So a lot of them, they say, I don't need to go to the second step. So that's when the gastric sleeve was born. What we do mostly is that we go directly into the stomach and we're gonna remove like 80 to 80% of your actual stomach. So leaving a very, very tiny portion of your actual stomach. So obviously the function is that you get full very fast. And the second of all is metabolic process as well. So we take that part of the stomach and we remove a lot of hormones that are produced in that part of the stomach that goes into your brain and causes you that hunger, that binge eating sensation. So after taking that, you don't get that hunger sensation anymore, or much less. So that's the part. It's called a restrictive and a metabolic process. So that's the function of it. Normally surgery takes like an hour, 45 minutes. Um, um, the cons that you can say, patients that after surgery, they can develop or continue having acid reflux up to 25 to 30% of the patient. This is related to some anatomical or patients that cannot keep following the diet. So if a patient previously they have like very bad acid reflux, Barrett esophagus, kind of like that, we prefer to go to the Roux-en-Y. So we can go to the next one. Okay. Okay, this a little bit of we were talking about this restriction because you have a small portion of your stomach. From the inside, it says that it's like the width of your thumb, so it's very very tiny. Less hunger that we were saying, and metabolic process. So the intestine, it was known to the function of the intestines to just absorb calories. So right now we've seen that the intestine is like a second brain. It communicates with our brain the whole time, produces a lot of hormones, enzymes are communicating. So doing this surgery, normally it shifts that communication into a better, healthier you. So it's a lot of processes. So that's the function. The single incision gastric sleeve is it's the same procedure, but it's done with just one incision. That's normally under the belly button, so it gets hiding into the belly button. So it's a little bit more, a little bigger, but but it's hidden. So it's mostly for aesthetic procedure. Obviously, it's not for all patients. You have to be a lower BMI. We have to be assured that when we're inside, that your liver is not that bigger, and if you do not have a hiatal hernia or other things. But but it has the aesthetic effect that you don't have the other incisions. The endoscopic gastric sleeve, it's a newer procedure. So this has the advantages of it's done completely through the mouth, through endoscopy. So what we do is that we go inside with the endoscope, and we are able to do some stitches on the inside. So it's like a plication from the inside. Um, Obviously, it's not as effective as regular surgery, but it has the advantage of just being endoscopic. So the gastric bypass, the Roux-en-Y gastric bypass, this is the older bariatric surgery. It's still considered the gold standard um, for losing weight. This is a little bit different because we get in a little bit into the intestines. So what we do is that we're gonna go to the stomach, and we're gonna cut the proximal portion. We call it the gastric pouch. Um, and second step, we go to the intestine, and we're gonna bypass a portion of the intestine. That's why it's called a gastric bypass. So in that bypass portion, it's not gonna get in touch with food, but it's gonna go directly to the last portion of the intestine. So it doesn't absorb calories, and as well as other metabolic effects. So that's the goal of it. The advantage is that it's for a patient that have acid reflux, bad acid reflux. Uh, you still lower your weight and your comorbidities a little bit faster than the sleep, and it could have a more lasting, longer lasting effect. Um, the other thing is that we go into the intestines, so we reroute the normal anatomy. So that's one of the cons that you can say. Okay. So normally, we ask for you to give your health questionnaire, and normally it's some aspects of your health and yourself. Um, when you're here, we talk to you. We do a pre-op evaluation, a more complete pre-op evaluation. So sometimes we say, for you, it's better this surgery or this one. So to say, um, like in a resume, you can say that the gastric sleeve it's good for patients that are lower weight, or they do not need to reduce their problem. They do not have a heart condition, lung condition, other thing that you need to lose weight faster, because if not, you're gonna get complications. So the acid reflux, we get to that part. Um, So normally with gastric sleeve, it's faster, it's less invasive, but still patients can learn to sheet later on. Some patients they learn to eat like slower, but more time, like in an hour there. So you have to have more maintenance with that. So the gastric bypass is like a bigger push, so it helps a little bit. Okay. Um, the mini gastric bypass. This is a surgery that Dr. Rutledge in the U.S. started doing it like 10 years ago. Um, in surgery, we call an omega loop, and it's been doing since like 100 years ago. But the doctor started doing it, and with very good results. The difference with the word mini could be a little bit more confusing sometimes. It should be called one anastomosis gastric bypass. In this case, we're gonna do a longer portion of your gastric pouch of the stomach. We go to the intestine, we take the intestine, but we do not cut it. That's when we do with the Roux-en-Y. We just leave it, and it's called an omega loop. So it's called mini because it's less surgical time. It's like 15 to 20 minutes less, but it has the advantages of doing two cuts or two suturings and having two potential sites of bleeding or leak. You just have one, which is the proximal one, reachable by endoscopy. So we've seen that like 10 years from now, we FDA just approved it a couple of years ago, and we've seen that the results are amazing. Patients lose the same amount of weight as the Roux-en-Y, and they get rid of their problems, diabetes, high blood pressure, as well as with the Roux-en-Y. So it's an excellent choice as well. So normally to say if you can have a mini gastric bypass or a gastric bypass. So normally if the same, if a patient has bad acid reflux previously, we prefer to go to the Roux-en-Y. The mini gastric bypass has less risk of internal hernia because we reroute less the intestine, so less risk of intestine like twisting or getting into causing a hernia and causing problems. So that's one of the advantages. And the other one is mainly the acid reflux, Barrett esophagus. We prefer to go to the Roux-en-Y. So that's in. We have other surgeries, the duodenal switch. This is a duodenal switch with a bilipancreatic diversion. This is kind of like, well, the duodenal switch is kind of like a bypass, but it's a longer bypass. This is for patients that they need to lose weight fast. They have a problem or they need to lose more weight. It's kind of the same. The only thing is that the anastomosis, instead of doing it into that stomach, into that pouch that we were talking, it's done in the duodenum. That's why it's called the duodenal switch. So it has its advantages because you still have the duodenum still, which is a bulb, and patient have less risk of a dumping syndrome after. And the anastomosis, the bypass portion is longer, very long. So just leaving like 8 feet of intestine total. That's gonna be absorbing calories. We have the SATIs, which is you can say it's like the mini gastric bypass for the duodenal switch. Is instead of having 2 anastomoses, you just have 1, and we do a sleep. That's the last S is for sleep. So these are very excellent surgeries. You lose more weight, but still you have to take more care after because you can get malnutrition faster. You have to stick with your vitamins and minerals as well as all procedures. But you have to be a little bit more risk of diarrhea. So you need more maintenance after, but excellent results. So. Well, we know COVID got us by surprise all around the world, and at first we stopped working a couple of weeks. We said no, we don't want to risk our patients. Then we started to learn to take all measures to take care of patients. So right now you've seen this, and it's like a regular day for us. But at that time it was like pretty scary, and we don't know what we're going to do. But still, as at that time, and still we're taking all measures. Actually, I have my face mask right here. So for us is taking all this protection and measures is like a regular day for us. So your health, and it's the priority to us. So still we ask the patients to wear a mask, social distancing. Prior to COVID, companions could stay here in the hotel. So that's one measure that we're still doing to help prevent any complication. You do a test prior to your travel or when you're here, and we're taking all measures. It's a common question. How fast can I return to work or to regular? So it depends. Well, 2 things. Depends on the type of work that you do. So if it's a desk job or if it needs to be lifting heavy things, so it depends on that. Normally, we recommend for you to have 2 to 3 weeks, sometimes 4, depending on on the type of work that you do, you have to have in mind that you're gonna do a pre-op diet. You're gonna be fasting the day of the surgery, and then right after we're gonna continue on a special diet. It's a four-step diet, which the first step is just liquids. So patients could feel low on energy, feel weak. So you have to have that in mind as well to return to work. Can we go to the other one?
Yeah, just wanted to mention here because a lot of questions come in here, like when can I go back to the swimming pool? When can I lift weight?
Okay.
Um,
Okay, yeah, yeah. Well, normally at time of discharge, you're gonna have a file, and we're gonna give you all indications, the diet and the indication. We have some lifting restrictions, so we recommend not to lift more than 15 pounds the first 3 weeks, no more than 30 the first 8. Um, what we want to avoid is doing too much heavy abdominal strengthening. So you can start walking a week after. You can start swimming whenever wounds are closed, and obviously not doing too much abdominal strengthening. We don't want for you to be doing like push-ups or abdominals or lifting yourself up. So that's what we want to avoid. But other than that, you can start. Patients sometimes they start walking at a week after and without any problem.
Okay, so thank you so much for going over all that information. I'm going to take over here and continue. So basically our packages are starting from 4,595 and it goes up based on the surgeon of your choice and also depends on whether you have additional BMI or extra fees like that. So we basically, we do not accept insurance. So this is all self-pay. Some of the patients need financing, and these are the financing options. We basically work with Super Money, e-financing, United Medical Credit, and you could also go directly to any of the lenders like SoFi or Best Egg, Prosper, Upstart, Lightning Tree. Make sure, however, you don't apply for maybe more than two places at one time, because it's gonna hit your score, credit score, and you're not gonna be able to get a good loan. Another question that was asked, and I see they're asking, is medical tourism insurance. We call them MTI. So basically, we offer the MTI for the limits that you see, whether it's travel related or surgery related complication. You have these limits, and we're offering this at discounted rate of $198. We basically using GPS to provide the services directly. We are not getting any piece of it, so we just transferring all the discount we're getting to the patient. It's just a peace of mind to have this at the cost we're offering it. It's so affordable, and we recommend everyone to opt in, especially the patients who are high BMI, the ones that are going through revision. Another thing I want to mention about revision is, let's say if you have a bypass and you need to do a revision of a bypass, we definitely recommend you do a blood test before you travel, because the blood test would show if your hemoglobin is high enough for us to do the surgery. It happens once in a while, but if you don't and you get there, we will not be able to do the surgery. So just do a blood test to show your hemoglobin before you come. Okay, so we are to the end of our presentation. Of course, we still have some of the success stories that we always share with patients. We have hundreds and thousands of these on our Facebook group, the patients that have gone through us. And for example, Jen, she did the bariatric and cosmetic with us. So these are all life-altering experiences that they share with us. And that's the plus of having that support group, that you see how other people doing and how they can be encouragement to you. They're asking about success rate. The success rate, it's like they say, okay, if you get gastric sleeve, your excess, you can lose excess weight about maybe 65 to 75%. But those are all just numbers. You can achieve your weight goal if you get the proper procedure and you stay with the diet and exercise. So, so let's just start answering the questions. So we see patients, they are at maybe 300 pounds, even 400 pounds, and they lose 150, 200 pounds with the gastric sleeve. If gastric sleeve is suitable for you, that's the option you go with. There is no limit. Of course, you know, bypass maybe is easier to maintain because you have that malabsorption component, but you can still, with the lifestyle change, with the diet, with nutrition, you can keep your weight down. We see these patients from years ago or past patients that are maintaining their health, they're maintaining their weight, and they have no problem. So whether it's bypass or sleeve, if you get the tool that you need and you continue with your changes in your life, you can maintain that healthy lifestyle. So Dr. Gutierrez mentioned about acid reflux. So about 10% or maybe less of gastric sleeve patients experience reflux. But then again, like Dr. Gutierrez mentioned, depends on what the source of reflux is. It could be anything in your anatomy that causes that. But a lot of the patients, because of weight, because of being overweight and obese, they get acid reflux. If that's the causing it, with the gastric sleeve, you're actually going to improve. You're not going to get that. But that's why we have you do the health questionnaire. That's why the surgeons talk to you before your procedure, because they talk to you, make sure you are getting the right procedure. For, let's say, if you're a smoker, if you like sweet, all these come into factor. And when you decide what procedure is best for you, so it's really customized and individualized. We don't have this one size fit all. And because of the expertise that the company has and the surgeon liaison is involved, we always match you with the best surgeon with the best procedure. Let's say, for example, I see companies that they can't perform high BMI RNY gastric bypass. So what they do is maybe they even approve you, but once you get down there, they say, oh, maybe sleeve is better for you, because they can't perform that. They can't perform the DS or SADs, or they can't perform some kind of revision. And then we also see with the fees, they give you some fee, and then once you're down there, they dime and nickel you. So these are the things you want to go with. The company has, like MBC, that has reviews, have patients' videos from past. You see how they're doing. Their success, it really depends on the skill of a surgeon too. You know, not every surgeon does the same type of gastric sleeve. Their experience comes into play. That's why you want to go with surgeons who are young, who have had thousands of surgeries behind them. They've seen all different types of revisions of different type of gastric banding, to sleeve, to bypass, to mini bypass. So you got to depend on the expertise of the company, expertise of the surgeons, experience of the surgeons, and the knowledge that they have. So again, you ask, what's the best procedure for me? Actually, duodenal switch has become more and more popular, but then, like Dr. Gutierrez mentioned, you have to stay with the vitamin for life. You have to know your nutrition is so important, because you don't want to have malabsorption component coming in and have some side effects for you. So as long as you get the best type of procedure for you and you stay with what is required for you to do, you'll be changing your life forever. It's a renewal of your life. It prolongs your life. It makes your quality of life better, and you be a whole new person. About the sagging on the skin, yes, some people get sagging, depends on how fast you lose weight, your genetics, your skin type, your if you exercise or not. So if you do get sagging skin, you can come back with us and we get one of our board certified plastic surgeons who are specialized in post-bariatric patients, because post-bariatric patients are different. They're not the same type of patient for plastics. So the surgeon has to be familiar, have experience with that type of patient. Again, for the DS, you ask me what's the difference between the two type of, so we have conventional DS and we have single incision, single anastomosis DS, which we call SADI. One is less invasive. Again, we're gonna have to depend on the surgeon's experience. If the surgeon has done so many of these and have seen the long-term effect of what is the best option, you have to depend on the surgeon to decide for you what's the best option for you individually. Okay, so again, we talked about returning back to work, exercise, being in the swimming pool in the slide that we went over. So they're asking Dr. Gutierrez, I want to let you answer this. If you find a hiatal hernia when you're doing the surgery, would you fix it? You would notify the patient, or you would stop the surgery?
Okay, yeah, that's a very common question. Up to 30% of patients that are overweight, they can develop because of pressure inside the abdominal cavity. They can develop a hiatal hernia. Most of them, they had symptoms like acid reflux, but some of them they don't, or they do not know. So whenever we do a procedure, mostly a restricted like a gastric sleeve, we always go and see if there's no hiatal hernia. And if we found one, it's better to repair it at the same time, because patients, even without any problem, at first they have a little bit of heartburn, but if we leave a hernia unrepaired, they're gonna have bad reflux after. So imagine end up doing an endoscopy later on and the surgery. So it's always better to repair at the same time. Whenever we found this, because you already sleep, so we take pictures before and after the repairing, so we can explain about your situation. But yeah, we always, if we find one, we always repair it. It's the thing to do.
Okay, they're asking, can you do a gastric sleeve on someone with uncontrolled diabetes type 2 with the A1C of 12 and sugar run from 240 to 400 on insulin injections?
We can, yeah, it's gonna help. But obviously, if it's very uncontrolled, it's always better for you to go to your primary care doctor and to help you with medications to help reduce a little bit. And that's because if you come like that, your body's in an inflammatory state, you can have more complications. So it's always better to treat that first. But yeah, after doing the surgery, that's gonna help very, very much. So yeah, actually right now, even doctors, even clinical doctors, they are saying go and do the surgery. That's the best treatment, most durable and more effective to treat type 2 diabetes.
They're asking how much of our support available to patients after surgery. So again, some companies we see that they offer a little lower prices, but then they charge, I don't know, anything like up to $1,500 for nutrition consult for long term. We don't have that limitation at this point. All of our patients are supported unlimited. So again, the packages that we offer are pretty much untouchable as we see. There is no comparison. If you put all the detail that we offer and compare it to any other companies, there is no comparison. Of course, you know, the main thing is the surgery itself. And just the surgeons that we offering are just the best of the best. And that's where it starts. And then it goes from there, from transportation to the support before, after. You need a FMLA for your work. We do it. All these details, because we're not a fly-by company. Our office here in Sacramento, where I'm actually, that's where the headquarters is. That's where all the staff are working around the clock to support patients before and after. We're not going to abandon you after you're done. And I said, well, you were done with you, you know, because we just got paid. That's not how we work. The patient care, like Dr. Gutierrez said, is our primary goal. And the packages we offer are so affordable. And what you get in the package is, you know, you cannot compare. So with Dr. Gutierrez, they're asking about PCOS and IBS. And this patient said that they had thyroid cancer and PCOS and IBS, extreme bloating and constipation. I don't feel hungry at all. How does my surgery can actually help to change my hormones and all that?
Okay, yeah. Yeah, we talk about the metabolic change, the metabolic effect. So yeah, obviously, not being hungry is one important reason, but it's not the main reason. Even if you're not hungry, your body is if you're overweight, it's in a constant inflammatory state. So that communication that I was telling about your intestine and your brain is not that good enough. So after doing the surgery, that communication is gonna get better. So, well, our goal is that PCOS is gonna go away, and the IBS is gonna relieve a lot. So yeah, it's gonna do a lot of changes, and it's gonna actually one of the surgery it's for a PCOS treatment. So that's gonna relieve or get way better.
So this patient is asking, I have a history of nausea and vomiting right after surgery. Will they be addressed with the medications?
Yeah, of course. Yeah, whenever you have a anesthesia, that's a common side effect. We actually do pre-medication for pain and nausea medication right before we start. And right after, you're going to stay in the recovery room. It's next to the OR. So we keep an eye on you, and we're going to be doing as much medication as needed. So obviously, the expected thing is the first couple of hours, the first day, but we do as much as needed. So we're going to take care of that as well.
Okay, so they're asking you about Dr. Seha. Yes, Dr. Seha is one of our top surgeons, but we do the webinars, we kind of rotate through all of our surgeons. I believe Dr. Seha was presenting maybe 2 times ago. So just stay tuned, probably 1 or 2 more times he'll be doing the webinar. So they're asking, what's the difference between VSG and ESG?
Okay, the BSG is the regular gastric sleeve, it's vertical sleeve gastrectomy. The endoscopic one, the difference is that it's made endoscopic. It's kind of like a gastroplication. We go inside with the tube. You have a slight sedation. We go inside with with the endoscope, and then we have a working channel from the inside that we can do some stitches around, and then your stomach, it's like application. It shrinks from the inside. So that's the difference mainly. And in the BSG and in the gastric sleeve, so we go from outside the stomach and we cut it with a special stapler that we use. So we remove 85% of your stomach. So that's the main difference.
I get a lot of questions about what's the difference between sleeve and mini sleeve.
Okay, yeah, well, the term mini sleeve sometimes can get confusing. Um, in terms of FDA, the term mini sleeve, it doesn't exist. Some surgeons or some offices, they call the mini sleeve as doing less incisions. Like instead of doing the traditional 5 incisions, they do 3 incisions. So they call it mini because of they do less incisions. The other thing, sometimes in some centers or sometimes the patient said, I don't want to get that 80%, that 80% of my stomach taken out. I want to do it less. So we can talk to patients. Obviously, the the technique says that you have to take that 80% for the results to be assured. So, but sometimes some patients they say, I don't want to lose that much weight. I want to take a little bit less. So we can work that out. But yeah, sometimes they call the mini sleep as some of those two terms.
Again, these are like the ESG, the endosleeve, mini sleeve, gastric balloon. These are all for the lower BMIs and people who are disciplined and they have the genetics and the lifestyle to maintain it. You know, so it's only like I showed you that the graph, this covers so many people can do diet and exercise, less people are, you know, can do only get away with endo procedures. And then smaller portion, they do have to get the bariatric surgery for long-term success. So you want long-term success. So, now, again, back to the companion. When COVID hit, our protocols was not to keep patients in the hospital for the safety of our surgical team, for the safety of the hospital staff and nurses, and for the safety of our coordinators, and on the most important, safety of the patients. There is less touches, less traffic when you don't have the companion in the hospital. So the way we are doing it, I think, is ideal. If you think about it, you come with your companion. Of course, you know, 55% of our patients or more come alone. There is really no need. Yeah, it's a scary thought to say, okay, I'm going to go to a different country, get procedure. But the minute you land, you're going to be with our staff, our professional people who have been doing this forever. They're going to put you at ease. They're going to take you to the hotel. Hotel coordinator going to talk to you. You'll be checked into the hotel. Everything is safe. Everything is tailored around your convenience, stress-free. And then they would tell you what to do next, what to do next, what to expect next. So there is no time that you're by yourself. So, but again, if you feel that your companion is necessary, it's your friend, family member, husband and wife, spouses, okay, you come with them the first night you stay together. Then the companion stays in the hotel, you go to the hospital, they come and visit you the next day, but keeping him in the hospital with you, it's inconvenience for them. Now you have their traffic added to the, just think about the contamination with all the viruses going on. We're talking about COVID. How about the flu season this year? It's horrible. Everyone is getting sick multiple times. And it's not, yeah, COVID was worse, but this is bad too. You're down for a few days and you catching it from your coworker, from your people, your family members. So do we want all these viruses to go around when you are down in the surgery? A lot of companies allow that, but they're really doing this not considering the safety of their patients. They're just doing that to sell more. And I think this protocol to keep the companion in the hotel is really saving a lot of headaches for patients, for staff, for everybody. And believe me, they hang out in Hyatt, they're happy, they have free breakfast, they can go shopping, they take them to tour of downtown, and then they go see their loved ones. And then once you're out of the surgery, you kind of like out of it anyway. And you have the nurses, you have our staff around you. So you're being taken care of. Anyway, that's, I think that's a huge factor for our success during the pandemic, COVID, and still now. We keep our patients healthy and happy until they leave and they go home. This patient is asking, my BMI is 39. Am I a candidate for bypass? If so, do I go with bypass or mini bypass?
Okay, yeah, the same. Normally, you can choose one surgery, and we're gonna check your health questionnaire. Normally, that's the surgery that you want to have. But when you're here, we gonna do a pre-op evaluation, ask you about your background, and we're gonna choose the one that's best for you. So checking on you, seeing your background, we can say if it's better one or the other.
Great, thank you. So another question, travel related, is they're asking, do I need passport or just an ID and birth certificate? So I would say we highly recommend passport card or passport book. And this way you are, most of the time, maybe with the ID and, a birth certificate, utility bill, you can go by, no problem. And then once in a while, you get that one officer at the border that is going to say, oh, we're going to pull you to the secondary. Now you're going to have an hour or two delay. You may miss your plane. All that things can happen. So why take chances? Just ask for the passport, whether it's a passport book or a passport card. So this way you have ease of mind coming in and going out. So they're asking, what are the complications and what could be the reason?
Okay, well, the two most common complications that we're aware of, it's having bleeding, obviously, like in any surgery, and having a leak. Um, right now, and fortunately, those complications are very, very rare. As Ron was saying, is less than 0.5%. Um, and that's why you stay here in hospital, because normally those complications arise the first 48 hours. So um, we take care of that. We still do some leak tests. Those leak tests are to prevent or to see if there's no leak or possible leak. And two of them are doing during surgery, just making sure that there's no risk of a leak. And then we wait 24 hours, and then we do another one that's made from like an X-ray machine, a fluoroscopy machine, um, and then just to make sure that everything's fine. The rest, as you get discharged and you get back home, is normally is that you have to follow indications. Um, Part of that diet that's liquid is because of a reason. Is because our stomach is not healed 100%, so we want for it to heal. And like doing solid food is putting too much pressure on your stomach. So imagine, I tell my patient, imagine it's a balloon that you put a patch on it and you let it rest. You don't go and inflate it at maximum capacity right away. So that's what you do when you eat solid the first week. So part is just following indications, taking care of yourself, and complications are very, very uncommon, very rare.
And again, that MTI, the medical tourism insurance, um, is good to have in case. Of course, once you're down there, you're under our supervision. If anything happens, we're going to take care of it right away. They're actively watching you 24/7. But if you came back home and there is some kind of an issue, you would use that MTI. Fortunately, we don't have anybody use it yet, but again, it's always a peace of mind knowing you have something you're not going to use or something you need to use, but you don't have it. And at the cost that we are offering this is almost 50% off, actually more than their rate that they're charging if you go directly to them. So I would definitely take advantage of this situation. We don't require vaccination or COVID test, but we highly recommend before you take off yourself and your companion before your departure, please make sure you do a COVID test, even a simple one, home version. Of course, you need to make sure you don't have the symptoms, but if you do, be very cautious, take the test, make sure, the vaccination, of course, helped. So it's really, that's a personal choice that you make. As far as the cost of the surgery, yes, we do have variation of the procedure based on the surgeon. But then again, some of them have been with us longer. So they are a little higher price. And some of them have been with us less. So they just have to, we just offer them at different prices. So they're asking, how could it be possible that after gastric sleeve, you're not losing weight? Because she sees some people that they're not losing weight after gastric sleeve.
Okay, yeah. Well, normally, as we tell our patients, this surgery is an excellent tool. It is still a tool. You have to make some changes, some behavioral, some nutritional. So the surgery is gonna make all the work for you the first year, the first 2 years. It's gonna make all the work. But then right after, well, the body is made for absorbing the calories, not to throw them away. So the body can use some mechanisms to start absorbing more calories, and that's where patients they start getting tired of dieting. They feel that they can fit a little bit more. Um, Stress, problems at work, problems at home. So pandemic. So sometimes patients, they start eating back again. So that's the reason why a lot of patients with gastric sleeve, it's most common, they start regaining weight because they do not follow. So we recommend for you when you head back home to go to your primary care doctor. If you can be sent to a nutritionist, that's always better, mostly for long-term results because they can change the diet and help you with that kind of issue.
So we find about maybe 5% or a little bit more of patients who receive, special, let's say if they receive gastric sleeve, they don't get to their goal weight, or they do, and then some events happen in life that they would regain the weight. And of course, you know, Dr. Gutierrez mentioned you are acquiring a tool that you can always work with to get you back down to your ideal weight. But if you're not successful, let's say if you got a gastric sleeve, you can easily convert that to a bypass or a mini bypass, and that would definitely get you all the way down to where you want to be. But again, you know, try to work with your tool, and if for some reason it's not getting you down to the weight that you want, there's always option. For a bypass, is a little harder. Bypass revision is not, I would say, is not as successful as a sleeve revision. And we always try to mention that to the patient. And if you qualify for sleeve, we definitely want to get sleeve because that's the best option, because you always have a way out, but not with bypass is harder. So the way the transportation works is once you get all your paperwork, you tell us, okay, I'm either going to drive to Tijuana myself, which is about maybe 1% or less of patients do that. I'm going to drive to San Diego. Again, very little percentage of people do that, or I'm going to fly in. So we put all that information in your file. We have a system that all of our staff from up here to down there, they're all connected and they see the same information. So the transportation is going to call you the day before your departure and say, introduce themselves, whether they text you, call you, they're going to say, okay, I will be expecting you at this time with this flight, and we'll be waiting for you. Once you come in, it's very simple. You just pick up your luggage. We recommend that you bring light clothing, light. So you probably one suitcase, not a big one, should be enough for you to bring everything you need. So you pick up your luggage if you checked it in, or if you had it with you in the plane, you just walk out. The curb is all tagged with letters from A, and you tell the driver, oh, I'm waiting at station F, and they come and pick you up. It's that simple. Okay, so again, our job is to make your experience stress-free, to make your transition from hospital to hotel to hotel to hospital, from airport to hotel, all that to be seamless. And that's our job. So you don't have to worry about it. Now, the question is, okay, so another plus is let's say we get your health questionnaire, the surgeon approves you for bypass, but you go down there, you still talk to the surgeon, and the surgeon says, you know what, you may be able to get sleeve because now this is a one-on-one conversation and consultation before surgery. It's not like we're going to say, okay, if you signed up for sleeve, you can't get bypass, or if you got bypass, you can't get sleeve. So the last minute, we can always switch you. if you book your flight, for example, for a bypass and you got sleep, we just have to keep you one extra night in the hotel. So nothing bad happens. You still go back on the same flight. So just, but don't book your flight before you are on the calendar and your appointment is set. So flying back or driving back to home is crucial that you don't sit down for long term. You get up and walk around, make sure you have compression socks. So just, and if you think your distance going back home, whether you drive or fly, is too much, you probably want to maybe stay 1 or 2 days longer, whether you stay with us in Tijuana or you can stay with us, in San Diego. We have a contract with one of the Hampton Inn by the airport that you can get special rate. If you stay with us in Tijuana, you just tell your coordinator, it will add it to your cost, and we do all the reservation, everything, so you don't have to worry about it. We don't take FSA as a payment, unfortunately. Some of the hospital rooms are shared, so it depends on what you are comfortable or you asking the coordinators. They try to accommodate the best they can. Of course, sometimes we have limitations. Sometimes we have situations that we can't accommodate everything you need, but we'll do our best to do what is best for you. So they're asking how many incisions you do if I have had scar tissues from a past open incision surgery.
Normally, at first, I would say the same incisions, 5 incisions. We will have to see what type of surgery they did, how long ago was it. But yeah, we do a lot of revision surgeries and even previous open surgeries. So at initial, I would say the same, 5 incisions, and depending on the amount of scar tissue or findings that we have, it's gonna depend. But mainly we say 5 incisions.
They're asking if there's a special discount for nurses or doctors. We would love to do that. We get actually a lot. I would say about 50% or more of our patients are either nurses in US or Canada or other places, or doctors. We actually have had doctors coming in getting surgery from us themselves. So we would love to do that, but we haven't raised our packages for so long. And we are maintaining the same quality, not cutting corners and offering the same price. So we don't really have room. The only option we have for discount at this point is buddy discount. If they stay in the same hotel room, we give them some discount. But other than that, unfortunately, we cannot give discount at this point because everything is rising. The hotel keeps, every few months, they keep changing our prices. Everything else, the life, how expenses are going up, but we haven't changed our packages, and we're trying to stay comfortable for you guys so you can afford and get this life-changing procedure. So when do I need to check my lab test, and when I come back, when do I need to come back to Tijuana or do any follow-up checks with my doctors?
Yeah, normally we recommend that you head back to primary care doctor, or previously if your doctor knows that you're gonna come to surgery, so he's aware. So right after you head back, mostly for a follow-up. So lab work is very important to be checking on your nutrition and your general health. So normally we recommend the first month, then the second, then 6, and then yearly. So if everything is fine. So yeah, if you're by the hand with your primary care doctor, that's always better. A couple of years ago, primary care doctors back in US, they were like, they say no, why are you going there? Don't go. But they seen the results, and now they're the ones who encouraging their patients to come and do the surgery. So it's a good thing.
They're asking if endoscopic sleeve is reversible or not.
Well, you can say because they do not we do not cut any stomach. We just put some stitches on it, so you could say that it's reversible. Um, so you can say that, yes.
Okay, so I mean, one of the questions was their question didn't get answered the last time. You know, we try so hard to cover all the questions. I try to, the ones that we covered during the presentation, we're trying not to repeat. If it's asked so many times, we do cover it. We're trying to cover the ones that are interesting. Everyone else can have the same question, but at some of the webinars, we cannot cover all the questions. I have 92 more questions open, and I respect everyone's time. I respect Dr. Gutierrez's time, of course. I respect all you guys' time, and I know a lot of you, we've been on for 1.5 hours. So I'm gonna try to probably look to see if any interesting ones I need to answer. So please do not be discouraged. You can always call us or email us and ask those questions from any of us in the office, or your patient coordinator. Everybody gets assigned to a patient coordinator, and that's the person knows your file the best. And they will interact with you with text, calls, or email. So please ask the same question to them if it didn't get answered here, but I have to stop at one time answering questions. I'm sorry if we didn't cover everybody in here. Okay, so that being said, one more item that I want to cover before we do our raffle is bariatric vitamins. We do highly recommend. Again, we talked about lifestyle changes, we talked about nutrition, and especially for bypass and DS patients, we highly recommend you take bariatric vitamins, not a multivitamin. For sleeves, same thing. We worked with the best manufacturers to build this vitamin line of vitamins based on ASMBS. Again, a lot of services that we offer is not just be profitable for us. We're doing this for the safety and well-being of our patients. So these vitamins give you exactly what you need as a post-bariatric patient. So it comes in the soft chew, chewable, drinkable, and capsule. You can get those from bariatricvitamins.com, emergebariatrics.com, I'm sorry, and also you can order it once you do the paperwork. So they will be shipped to you directly. Okay, so we're coming to the end of our presentation, as I promised, and we always do, is we do have a winner for a raffle. Is, of course, you know, I need to make sure that that person still is with us, because that was a requirement. Yep. Brenda Kistner. Brenda Kistner, I'm going to allow you to talk and share your experience, your hello.
Well, yay. Hello.
Hi, Brenda. Congratulations from NBC and Dr. Gutierrez to you.
Thank
Fred,
you.
go ahead and tell us, have you scheduled with us yet, or are you a potential patient?
Well, it's something that I've been researching very much. And yes, I have scheduled with you.
Okay, okay, great. So who was your surgeon and when was your surgery?
My surgery is February 11th. And Miguel,
Montalvo, okay,
yes.
okay. All right, that sounds great. So please contact your coordinator today. And where are you coming from, Brenda?
I'm coming from good old West Virginia.
Wow, that's great to have you. And again, you need to schedule within a certain amount of time from your
Okay.
appointment, which I think it will be okay because we only have less than 1 month. But please make sure you be in contact with our coordinator today. I will let them know as well. Thank you so
Okay.
much for
Thank you.
going to attend. And thank you so much, Dr. Gutierrez. I know you're busy, but taking time to attend our webinar, appreciate. Goodbye, everybody, and we see you soon. Thank you.
Bye-bye. Thanks.
Bye. Bye-bye.